I'm Dr. Newman from South Bay Plastic Surgeons, and I'd like to welcome all of you to our RHA virtual event that we're going to be having with you today. Now, many of you probably haven't heard about RHA filler, but we're going to tell you everything that you need to know. What it is, why it might be good for you, and we're going to finish up with some exciting prizes at the end. Now, just to give you a little quick introduction, we're here at South Bay Plastic Surgeons in Torrance, California, and we offer the full spectrum of plastic surgery, everything from cosmetic surgery, reconstructive surgery, and a full-service spa. At the spa, we have lasers, we do fillers, neurotoxin, etc. But today, we're really going to focus entirely on RHA filler and the specificities about it with some demonstrations so you can learn more about it and find out if it's really a great option for you or not. We're also going to give away some great items at the end. Specifically, we're going to be giving away some raffle prizes that will include a variety of goods and services. Those raffle items will be announced by email, so make sure you give us your email. And just in case you don't get a raffle prize, don't worry. There are going to be goodie bags that we give to every person that signs up for an appointment during this event. So if you sign up for an appointment with us, you'll get a free goodie bag with a bunch of fun packages in there to help treat yourself and to educate yourself about RHA. Now, a couple of quick announcements before we get started. Number one, you can submit any questions that you have during this entire virtual event through the virtual event interface via the questions tab. So if you submit a question, that question will get answered at the end of the event by one of our providers live. So you'll get all your questions answered at the end of the event. So make sure you stick around through the entire event in order to get your questions answered at the end. We are looking forward to a fun event with you, learning all about RHA and all about what RHA can do for you.
All right, so here we are again with Camille. We have elected to proceed with injection of RHA filler, which is here. The reason I like this filler and the reason that we're going to use it today is given Camille's concerns, they're really in areas of high movement, of a lot of expression, of a lot of dynamic animation. And this filler, it's the least chemically modified, it's very soft and natural looking, and I think it'll fill well in those areas. This is the RHA 3, which I think is a great filler for the lower face, and so for those marionette lines and the areas of expression like I was talking about, this is a very dynamic filler, and it's great for that area. So, looking at her face, you can see that there are these like lines that are here, and they do actually kind of go away when she expresses, but when she goes back to rest, they're kind of there. So by filling in on just the inside of both sides, I think it'll give her a very nice natural result. And so we could just go ahead and get started. We're not going to put a lot, just enough to really hide that area. Now we're going to go ahead and move up to the upper face, and so we're going to try to fill in this part of Camille's malar region. And I think that building up here, where I'm holding, will really help the overall structure of her face. We can see that it looks nice and natural. She's not a bruiser, which is good. And same as before, we'll just massage it out a little bit. Okay, and here we are with Camille. We are done with half her treatment, which again, she had half a syringe of RHA 4 up in her midface. And the reason I like it is it's so minimally chemically modified that you can use it a lot more superficially or closer to the skin, and I think it gives you a lot more of a dramatic effect than some of the other fillers with less volume. And it really helps to rebuild this cheek area and kind of lift a little bit. She had half a syringe of RHA 3 down here. That one I like because it's very dynamic and it's perfect for an area with a facial expression that's also dynamic. So I think the 2 and 2 go nice hand in hand. Okay, so Camille has undergone RHA injection, which is a great filler for Camille, given her goals, given her facial structure and the areas of loss that she had. Here at South Bay Plastic Surgeons, though, we carry all types of filler and offer all sorts of surgical and non-surgical treatments and customize each treatment to each patient. So I would recommend that you call the office for a consultation so that we can best meet your goals.
Okay, so we're going to be injecting some RHA today. I'm using 2, and my lovely model here, Frida. So if you look at her, she really doesn't need a whole lot. So when you look up, she does have a little bit of hollowing right here, and this is a good test that, like, when I look at her forward or like with her straight on, I'm like, oh, she doesn't need anything. But then if you have them facing forward, but when they look up, you can see a little bit of hollowing. That's where you see the hollowing best. So I'm going to be putting RHA here and just a little here. She doesn't need a whole lot, and less on this side. And then looking at her, we can just do a little bit in through here and in through here, because RHA is so great for a dynamic area because of how it integrates with the tissues, so you don't get like that migration and clumping. So we'll do a little in through here, a little in through here, there in her under eyes. And if I have any left over, I may even do a little bit in this sweet spot in her temples to lift that up, because that's really the only place where I see like a teeny bit of hollowing. And that's it. So let's get to the injection. So this is an area that tends to hollow out, that we sometimes leave because you think the tear trough always hollows out here. But when people are getting Botoxed, they tend to hollow out here as well. And I love starting here because it then supports this area and picks up this area, just like if you're doing lateral cheeks. I like to have them with open eyes, because when they close your eyes, a lot of the hollowness goes away. So you see a lot more when it's open. So basically I'm injecting periosteally on the bone, on the rim, and what I do is I just put little small aliquots there, and then I press to spread them out. Make sure everything is smooth. So do you see like how that area nicely just filled up, and it looks very soft and natural? Smile for me and relax. And a lot of times when you do this area, some people don't even need to get Botox down there, which actually looks better, I think. Okay, beautiful. All right, smile. I like to have them animate as well. Smile again, as much as you have. And so you can see when she smiles, Smile as big as you got. She's Botoxed. So then that creates this hole there. And then that's why it looks hollow, or why it gets hollow and even more hollow as we age. So I'm going right there. Again, a little is better. So because RHA has a lot more hyaluronic acid, it has 23 milligrams, a little goes a long way. So don't, and with eyes anyway, you never want to underfill, you want to undercorrect, because you can always go forward, because then you don't want them to get puffy. If they have allergies, everybody in California has allergies. Okay, so with the under eye area right here, this infraocular area, again, when you're injecting, you want to make sure that you're finding the foramen, because that's where the artery, nerve, and vein come out of. I feel it right there. She's pretty textbook. So obviously that's your no-fly zone. I like to use little needles because it's way more control. I feel like when you're using a cannula, it dumps too much product in, and usually that's when I have to correct people. Okay, so I'm just feeling for her bone here. And again, I know that's where her no-fly zone is. Look up. That even opens out even more. So I'm just going to do small little aliquots right here. And you can do it perpendicularly, you can do it at an angle. So I'm having her ice in between the injections because, you know, as we're injecting, we have, you know, there's lidocaine in here, which is a vasodilator. So then that way, you know, I'm trying to minimize bruising. I sometimes pull the skin down because I can see it spreads the skin and makes it more visible for me to see the her little capillaries that I can avoid if I possibly can. Smile one more time and relax. Okay, I'm just going to do one more there, then we're done on this side. Okay, smile and relax. Okay, so we have to be really careful in this area, because even if we put a little bit, sometimes that can, you know, migrate up, because, you know, things move in the tissue and you don't want this to get over pronounced. So as much as I want to go there, maybe I put a drop, but smile. Stay smile. I think I'm just going to do it while she's smiling, just to put a little there. Okay, close, or be relax, yeah. Yeah, and on her, she just naturally goes down there. So I don't want to keep trying to make that perfect, because all it's going to do is just go in through there. And, you know, then the next person's going to inject somewhere else, and who knows, and all that. And then with any remaining filler, on this side, we all tend to, this is the pre-gel sulcus, we all tend to dip in through there. I'm just going to connect that area. And that side is done.
Hi everyone, my name is Jeremy. I'm the physician assistant here at the spa at South Bay Plastic Surgeons. I'm going to be treating Nadine today with a little bit of RHA2. We chose this product for her lips today. She's already got some really beautiful volume in her lips, and so this really nice soft RHA2 is perfect for just a little more structure and just a tiny bit of added volume. And just this product in the lips is so beautiful because it does have such dynamic movement and really a natural kind of flow to it. So I'm looking forward to just giving her a little bit of a tune-up with this today.
Hi, I'm Valerie, and I like RHA because I have nice lips to begin with, and I never ever said that I would ever get filler in my lips until I started getting older, and I started to get the little lines around them, just little tiny lines where your lipstick starts to bleed. And I wear red lipstick, as you can see, and I didn't want that big trout looking thing, yada yada. So with RHA, when it came out, it's more pliable, thin, and movable for dynamic lines, and I talk a lot, so I didn't want it to be noticeable. I wanted it to look natural, and in my opinion it does. I love this stuff.
Hi everyone, it's Dr. Newman again, just wrapping up our session about RHA. I hope you enjoyed our virtual event. I hope you found some of this information knowledgeable. I want to make a couple of reminders here for you that any giveaways, all the raffles that we are giving out, you will get notifications either by email or by phone, so make sure you check your email or phone to see if we've announced any giveaways for you. And don't forget, we are going to be continuing with some live question and answer session here in the next 15 to 20 minutes. So don't leave yet, we're not done. Stick around for the remainder of the question and answer session to get all your questions answered before the end of the evening here tonight. Thanks a lot for joining us, South Bay Plastic Surgeons. Hope you get to visit us in person soon.
Hi, everyone. Hope everyone is enjoying our virtual RHA event. I am Dr. Rendon with South Bay Plastic Surgeons, and I'm here to answer any questions you guys might have after that presentation. Hope everybody enjoyed it and found the information valuable. Let's see, there's several questions coming in. I'm going to read them and I'll answer them as we go along. The first one is, hello, I'm wondering how long RHA lasts compared to other fillers. Most of the studies found that RHA lasts about 15 months. Relative to the other fillers, some fillers will last as little as 9 months, and some claim to be there as long as 2 years. It just depends on the patient, depends on the filler, the area that it was placed, and actually the study that was done. The people that say that it was 2 years, often it's just like there's evidence of filler, but probably not the entire amount. So this one will last about 15 months. The next question is, hello, awesome presentation. I'm curious how RHA compares to Restylane Kiss for lip augmentation, as this is the injectable I have used historically. So RHA is divided into RHA 2, 3, and 4. And the difference between those has to do with like their strength and their pliability and just the area that we're going to use. And that kind of dictates where we place it. I would say that RHA 2 is probably very similar to Restylane Kiss or comparable, and that's kind of where I plan to use it. Places like the lip, where it's going to be a little more superficial. You don't want it to be seen. You kind of want it to adapt to the tissues around it. So I think it would probably compare the most to RHA 2. And the next question is, I heard different numbers, RHA 2 or 3 or 4. What are the differences? As I was saying earlier, the RHAs are really divided by number based on their strength and their pliability and their thickness, not unlike some of the other fillers. And that kind of dictates where we can place them, how deep we can place them into the skin or into the deeper tissues. The reason I like it, and I think it goes to say a lot about this, is RHA in general is very resilient, meaning that it can stretch a lot with the movement of the face or the dynamic motion. Historically, a lot of the traditional fillers sort of occupied a space. And in occupying that space, they did help with wrinkles. They did help with some deficiencies that patients had. But the filler would move around them as opposed to move with them. And the difference with RHA is that because of the pliability and the resiliency that it has, it will move with the tissues that it's incorporated in, as opposed to the tissues having to move around the filler. The next question is about side effects. So are there any side effects of this treatment? I would say that the side effects of this treatment are not unlike the side effects of other fillers, which would include things that we can all expect, which is a little bit of swelling up front, possibly some bruising, depending on where it's placed, and maybe a little bit of redness the day of. Beyond that, some of the more complex or less likely Side effects would include things like asymmetry, meaning the left side may not look exactly like the right side. And that's something that we often discuss in the consultation because most of us don't actually have symmetric faces. And so we can use the filler to try to address those, but not typically correct all the way. Next question. What filler did Stephanie say she was using? Stephanie, I believe, was using RHA 2, which is actually the most pliable, the softest one. And I think if you watch her video, it makes sense to use the softer, more adaptable filler in the areas around the eyes and the areas around the superficial creases along the chin and stuff that are going to be a little more noticeable. Somebody wrote, I came in late, how much RHA was put into her cheek? I don't know whose cheek we're referring to because two of the models had cheek filler. I know that the first person had half a syringe per side. I don't exactly know how much was injected into the other person. What's the difference between RHA 2, 3, and 4? So this already came up. And then what's best around the eyes? Probably around the eyes, it would be best to have a consultation. And the reason is when I see a patient for either tear trough deformity or hollowness around the eye, what I typically do is kind of really assess their face and where they have loss. If they have malar region loss, which means the area right around here, I can often use thicker fillers, or in this case, a product like RHA4, to fill in or replace the tissue that's around here. And that many times will actually address what to patients or to us looks like a tear trough deformity. Now, in somebody that truly wants the area immediately under their eyes injected, I would probably use something a little more pliable like RHA 2. And then there's another question from a patient that says, hi, Dr. Rendon, I have not met you. Are you new to the practice? Do you have an area of specialty? So yes, I am new to the practice. I joined very recently and I'm very excited to be here and to be part of South Bay Plastic Surgeons. And I will be focusing mostly on breast reconstruction and aesthetic surgery of the face and body. I actually do have a very strong interest in injectables and laser treatments and in non-surgical facial rejuvenation. The next question is, are there contraindications after injection, specifically concerning home microcurrent devices like NuFace? Typically, I tell patients in our spa, will advise most patients not to do anything like heavy exercises the day of, not because you're going to move the filler, not because it's going to displace for any particular reason, more so because any vigorous exercise is going to cause you to swell, it's going to cause vasodilation and can cause the filler to possibly spread a little, but more than that, to cause you to swell and cause you to bruise a little more than if you take it easy the day of injection. I also recommend that patients don't sleep directly on their face or directly on the area that was injected the night of injection. After that first day, you can pretty much resume normal activity. Next question. How do you know if RHA is right for you? I was told Botox would be better for me for under my eye. Would you be able to explain why I may have been told that? So I can't specifically address why any one person would have been told about Botox versus filler. I do think that there's a role that each of them play. I think that if the concern are the crow's feet or the wrinkles immediately around or around the eyes, then that would be best addressed with a neurotoxin such as Botox. That said, I think that the areas that can be addressed with filler are the actual tear trough or the hollowness that happens, especially right here in the middle. So I would recommend that that particular patient call for a consultation at the spa, and that can be addressed. One of the things that I like about our spa is that we offer both neurotoxin, lasers, and a variety of injectables. And so we try to cater each treatment to each patient, and we can tell you what you need at that time, as opposed to try to push any one product on you particularly. The next question is challenge with wrinkled lower face, chin, jowls, i.e. ball cap, sun damage. Does RHA work for broad swaths? I actually do think that RHA is a good filler because it can be put in different places in the face. Like I said, I've always liked filler, and I think that there's room for all the products that are out there. But this particular product, what I really like about it is that you can put it in places that are moving a lot, and that won't look off or won't look worked on if you use it, because it'll move with you, as opposed to, like I said, the tissue having to struggle and move around it. Next question. If I'm having a peel done to get rid of sun damage, do I wait to get RHA? If so, how long? I personally think that if you have the filler done, if the plan is to do both, and you and your provider both know that you're going to do both, then I think it's reasonable to do the filler and then do the peel the same day. I would not do it the other way around. The reason is your skin's going to be raw, your skin's going to be irritated, and then to go have to clean it off and inject the filler, I would not do that. But I think it'd be okay to do the RHA filler first and then do the peel. If you do it in the reverse, I would wait about a week. I would wait about a week after the peel and wait till your skin has stopped peeling, has recovered, before you undergo any injection, really. Next question, if you have a different filler in already, can you use RHA to add a little more? Yes, absolutely, yes. Some of the other fillers that I like are those that you can use in this region pretty deep. What I don't like about those is that you can't use them more superficially. I think the other fillers you can use deep and then layer on top RHA, I think that would look great for someone that has true malar loss. In a younger person, where we used to use that other fillers to bulk up this area, now RHA can actually just be used right in the cheek to add cheek prominence or a little more projection in that area. So yes, absolutely, you can use more than one in combination. Can this go over other fillers that are wearing off? Yes, as I mentioned before, I think you can use it in combination, or you can use it right after using a different one or months after. What is the average for 40 plus to get a full lift using RHA? I need some help all over. This is a tough question. I think it depends what the areas of concern on. But typically, if somebody is over the age of 40 and has a little bit of loss along their cheekbones here, and maybe some prominent nasolabial folds that they would want addressed, I will offer as minimum as half a syringe per side on the nasolabial folds to as many as 3-4 syringes total. Just really depends on the patient's needs and what their goals are. If their goals are to really lift, then we need to use more. If their goals are just to address a couple of little subtle changes that bother them, then we can use a little less. Can I get filler on same day as consult? Yes, absolutely. Typically we set up, we time our consults in such a way that would allow enough time to do both, to talk to you about your needs and your goals, and then to go ahead and inject you the same day. Next question is, can this be used in the necklines? Again, it would really depend what the goals are and what is bothering the patient. I think that the necklines can be addressed with RHA. I've not used a ton of filler, period, on the necklines, but in the right patient, I think there is a role for it. One of the things that I forgot to mention is our specials. And so typically the cost of RHA at our practice is $7.75 per syringe. For all those participating in our event, our special is $100 off per syringe for syringes number 1 and 2. If somebody buys 3 syringes, they get the 4th one for free. And that special will run through the end of January. So if you call the office in the next couple of days, book your consultation, mention that you were part of the event, you'll be eligible for special pricing. Is the skin consult done by one of the doctors or by one of the technicians? So filler injectables are done by our providers that work in the spa, and that's a combination of myself and some of the other surgeons, as well as our nurse injectors, PA injectors. All are fully trained in injectables, and when you call, you can request a specific provider if you'd like. Do you do the RHA injections yourself, or are they done by the nurses? So both, as I was saying. I do it myself all the time, as well as our injectors. So it just depends on the patient, what who they want to see, and sort of availability and consultation requests. Another, for anybody that's interested in getting a consult, I just wanted to remind everyone that everyone's going to get a text following our session. And if you reply yes to that text, our office will contact you to set up a consultation or to help you do that. Can this be used in the hands? I would say yes. The use of filler in the hands in general has grown in popularity, I would say, significantly in the last 3 to 5 years. With its pliability and with its stretchability, I think this would be a great product to use in the hands, considering the amount of motion that we all have with our fingers and kind of with the back of your hand, with all the tendons gliding and such above it. I think that using the filler in that space would be great. Will this filler help with the jowl area for a person in their 50s? That's a good question. And I think if it really depends on how bad the jowling is, how significant or severe it is, and what the goals of the treatment are. If they are to completely get rid of the jowling, then I would say probably no filler is going to help permanently. But if the goal is just to fill in the shadow that I think we all start to develop right in this area, then yes, I think this is a good filler to use. Because of the motion of the face and the way that we all express, this would be a perfect area to use a filler that is adaptable and that's pliable, because it'll fill in and it'll move around with the motion. How about deep smile lines? So deep smile lines, so out here and out here, I actually typically do a combination of filler injections. If somebody truly has deep smile lines, then I tend to use a slightly thicker filler, such as RHA 3, to place into the deeper layers of the skin, to bulk up the area and to sort of re-establish the support that was once there. And then I layer on top a more superficial filler, such as RHA 2, to really try to pop out or try to diminish the more visible fine lines that you can see in that area. So I think, like I was saying, I think it all depends on each patient. I think there's a role for multiple fillers, and I think that the ability to layer these on top of each other makes them great products. Let me see what other questions are coming in. Is it good for chin and jaw? I think RHA is a great product for chin and jaw. RHA 4 can definitely be used. I would definitely use it here in the chin for augmentation. And in the jawline, it really depends where. I think it would be a good product to put around here because of the amount of motion and expression that we all have in this area. So yes, I think it can definitely be used for the chin and jaw. There's a couple more I think I looked over, so I'm just reading to make sure that we didn't miss anybody. Can it be used in the nose to even it out? So the use of filler in and around the nose is pretty popular. And I think in the right patient, it is a good product, especially for somebody with what we call a short dorsum, or a dorsum that is low. I think it can help to augment the entire nose a little higher and to even out that region. And again, I think this product would be great for that as well. Okay, seems like some of the questions have slowed down. I hope that everybody found all this information helpful. And I just want to make sure I didn't miss anyone. Oh, here's a good one. If I have an event, how far out do I need my RHA done? 2 weeks or a month? I usually tell patients for filler to try to do it about 2 weeks before any special event. The reason being is the initial period can be you can have a little bit of swelling, you can have a little bit of bruising, and that usually goes away in around 5 to 7 days. I think that with 2 weeks, that gives you plenty of time to recover from any swelling, any bruising, and I think it just buys you a good amount of time before any significant event. Which is the best to fill hollow temples? So I think the temples are a great place to use filler, especially products like RHA. I would actually, if it was me injecting somebody and depending on the severity, I would probably layer on RHA 4 into the deeper space and then a little bit of RHA 3 just to even it out and really help with the contour from the temple up into the forehead and down into the lower face, the mid face. There's another question about specials, and so I just want to reiterate the specials one more time, which are $100 off each syringe, or buy 3 syringes, get 1 free, and those prices are eligible through the end of January, so long as you attended the event, and call to book your appointment in the next couple of days. Let me just give this one more look. So as I was saying about this product, before we finish up or wrap up, I wanted to remind everybody kind of why I think it's a special product and why I think it's something to consider going forward. I think in the past, all the fillers that had come out were really meant and approved really for static lines or lines that are there when we're not moving our face. I think those products are great and they'll continue to have a role for many years to come. But I think the difference is that RHA was truly designed to move with your face and to move with the muscles and the soft tissues where they're injected and to adapt into those spaces. So I think this will truly be a game changer in how we address facial rejuvenation and how we think about filler going forward. There's one final question that is asking about VIP discounts. No, we don't combine specials, but we can discuss with patients, with you when you call. So I would still go ahead and call and see what kind of promotions we can provide. So with all this said, a couple of final housekeeping things. So number one, the winner of the raffle will be announced tomorrow, and that person will be contacted by email or phone. Again, our special pricing that is going to go through the end of January for anybody that participated will be $100 off the syringe, $100 off each syringe, or buy 3 syringes, get 1 free. Additionally, anybody that calls in to schedule an appointment for a consultation will be given a goodie bag with products and some information about RHA. So with all that said, thanks everyone for joining and for being here, and hopefully you found all this information helpful.